Canadians are aware of the very tragic loss of life as it relates to young people who have died by suicide in recent months. This is set in a context of a whole range of other very unfortunate and unacceptable gaps in health outcomes that Indigenous peoples in Canada face. Today, in that context, we have agreed to work both at the acute needs in these communities and have agreed upon some specific work that needs to be done. One of the communities most seriously affected is Pikangikum, and today we have agreed upon the Pikangikum Action Plan that will guide our work and form a framework going forward that our officials will continue to work on to deliver. And we have also talked about our long-term plan, and that long-term plan is that the three orders of government will be working together in a very ambitious plan to do the work that's been recommended for a very long time, and that is to work towards the transformation of health systems as it relates to First Nations, with a goal that NAN, Nishnawbe Aski Nation, will, as soon as possible, be in a position where the health systems of NAN will be designed by and delivered by and controlled by First Nations.
I think it's an acknowledgement by all parties that the colonial health system that was set up and currently exists as it pertains to First Nations across this country is not serving First Nations communities well. The inequities that exist, the lack of access, the poor outcomes that we're seeing, we need to, in a collaborative fashion and taking our lead from First Nations leadership and communities and frontline healthcare workers themselves, fashion a health system which will achieve those important outcomes of access and equity and the highest quality of care.
Today is a very significant day for the Nishnawbe Aski Nation. It's something that we've been working for some time now. And I just want to echo the words, the message from many of our communities that they are ready. They are ready to take on healthcare for themselves, for their communities. And the document that we signed this afternoon allows, or it outlines the principles that will help all of us, guide us to where we want to go.